Dudeja. After finishing scopes and other instruments in ENT, other very important surgery as well as surgical instruments in view of your exams, postgraduate exams or entrance exams or even undergraduate exams, these instruments are very important and they are being asked. So this is your first tonsil instrument. This is Boyle's blade and this is Davis mouth gag. Together we call it Boyle's-Davis mouth gag. In this you should know that this is the part which remains fixed during the surgery and this is the part which is mobile. How these are attached? From inferior part we put it inside. This goes into the oral cavity of patient. This will be attached to upper incisors. This part will depress the tongue. Once it is in the oral cavity, we open the oral cavity. This is basically used not only for tonsillectomy but for any oral surgery apart from tongue and floor of mouth. Reason? Because this will be covering most of the part of tongue as well as oral cavity, floor of the mouth. This plate is available in various sizes according to the age of the patient. For children it is smaller, for adults it is bigger. This is largest size of plate. So this is Boyle-Davis mouth gag or Boyle's blade, Davis mouth gag. Boyle-Davis mouth gag. This is Graphene's bipod stand. How we use it? We use it with Mogren's plate. So we attach the plate and this is used basically along with to stabilize Boyle-Davis mouth gag. This is like this. Whole of the unit become like this. So this is so that you should not, one person should not be always holding this instrument. For this is Graphene's bipod stand and Mogren's plate. This is Dennis Brown tonsil holding forceps. This is basically to hold the tonsil and to pull it medially. So suppose this is patient and I am doing left side of the patient, I'll hold it in with this hand and pull it medially. Suppose I am doing right side of the patient, I'll hold it with left side and pull it medially. Because pulling tonsil medially, the mucocutaneous junction that comes into place where we want to put incision. So this is Dennis Brown tonsil holding forceps. This is Mollison's tonsil dissector and anterior pillar retractor. This part is used for dissecting the tonsil from the bed of the tonsil. Once you have dissected the tonsil, if you want to see the bed of the tonsil, this is anterior pillar retractor. We pull the retractor, we retract the anterior tonsillar pillar with this part. So this is tonsil dissector and anterior pillar retractor. You can have a good look at this instrument. This is Eve's tonsillar snare. In case of tonsil, we don't cut the part of tonsil when we reach the lower part or the lower pole of the tonsil. After dissecting with this instrument, what we do, we have to snare it off in spite of cutting it or in spite of shearing it off. So what this does is, there is a cable wire inside this instrument. We pull the tonsil from this part. We slowly keep on reducing the lumen of the instrument. This will have a constricting effect on the lower pole. Because of this constricting effect, various coagulation factors are activated. Slowly we tighten it down and the pole of the tonsil ultimately is crushed. So with this action we are actually not cutting the pole, we are basically crushing and detaching it. So crushing basically leads to activation of coagulation factors which leads to lesser bleeding. So this is Eve's tonsillar snare. The moment I pull it, this goes inside. Eve's tonsillar snare. This is Negus knot tire. Suppose after tonsillectomy there is some bleeding point, what we can do is we can hold that bleeding point and we can tie a knot. In oral cavity we cannot put our hands inside, so for pushing the knot inside, this is Negus knot tire. We tend to hold the strings of tie and we push it with Negus knot tire. So have a revision again. Boyle-Davis mouth gag, Boyle blade Davis mouth gag, Graphene's bipod stand, Magaran's plate, Dennis Brown tonsil holding forceps, Mollison's retractor and tonsil anterior pillar retractor and tonsil dissector, Eve's Transverse Snare, Negus knot tire. Thank you.